I married my first cousin. I experienced my first miscarriage, and later my first daughter was born with a genetic disorder. She has missing ribs, a lung herniation, and severe scoliosis. It was extremely difficult as a mother to give birth to a child with multiple abnormalities. Going through the challenges of pregnancy and postpartum recovery while facing the reality of your child conditions puts a heavy burden on your heart and mind. Many questions come to your mind. First, why did this happen? Then you begin to wonder how the disease will progress. Will your baby be able to walk? Will she be able to do things like other children's? Will her mental development be okay? There are so many challenges ahead. The first burden in our society is giving birth to a daughter, especially when in-law sees her as a burden to their son. If the child has a genetic disorder, it becomes even harder to answer people questions. Often the mother is blamed for the child conditions as if she alone is responsible. I have gone through many challenges and my mental health has been deeply affected. I started experiencing my memory issues, and at the same time I was doing PhD in neurodevelopmental disorders. I never imagined that my own child would be born with the genetic disorders affecting her bones and growth. As we began seeking treatment and consulting with doctors, I remember asking whether my baby would ever be able to walk. During one ultrasound of her hip joint, the doctor said she would likely be able to walk, and I was so happy that day. But watching my child struggling even to stand was heartbreaking. Doctors recommended a rigid brace for scoliosis, but it was very uncomfortable for her. Still, we tried to use it, going every third month for adjustment or a new brace. Each time, my daughter resist wearing it, while doctor insisted that it's very necessary. Also, I was handling everything as a single parent. Her father lived abroad, provided financial support, and only visited us for a few days. As time passed, her scoliosis progressed rapidly and became non-correctable. Her overall health remained weak, and she would catch infections nearly every 2 weeks. Now she's 5 years old. Doctors have recommended surgery for her, but thinking about that surgery is overwhelming. Will she able to bear such major procedure? A painful experience. I am suffering a lot as a mother, and he is also suffering as a father. He constantly worries about her future, just I like do.